In part two, we'll be looking at fiber and also understanding blood glucose levels and what happens when we get things such as diabetes and how we should prevent it. So with regard to fiber, fiber is part of a complex carbohydrate, and it's difficult for the body to digest it. There are two types, soluble and insoluble. Insoluble consists of cellulose and lignins, and it increases the fecal bulk, and it may make your bowel movements a little bit easier. You find it in plants such as wheat and rye, brown rice, typical whole grains and vegetables as well. Soluble fibers are pectins and gums and hemicelluloses, and they delay the stomach emptying, so it slows down the absorption of the glucose or the sugar. So they include apples, bananas, citrus fruits, carrots, beans, etc. And the one thing that's interesting, if you think about an apple, for example, apple has fructose or fruit sugar, but because it also has the skin, which contains fiber, soluble fiber, when you eat an apple, it's very important to eat the apple with the skin on, because if you ate it without the skin, then it'll be easily converted to sugar, where when you're eating it with the skin, the fiber delays the glucose or sugar absorption, so it almost negates the sugar, so it's much healthier for you. When we think about fiber, we have to think about whole grains. These grains are intact. They're not processed or cracked. They must have the bran portion, the endosperm, and the germ. When those parts are not, broken down or processed in any way, that grain is considered whole. It's important to eat complex carbohydrates such as fiber and whole grain. They help to maintain the blood glucose levels. If you have too much sugar, not enough fiber, glucose levels can be negatively affected. So we want to maintain blood glucose levels, and we could do that by eating small meals each day and making sure those meals are filled with complex carbohydrates as opposed to simple. If blood glucose does get elevated, like it will after a meal, what ends up happening is the pancreas will release insulin, and that allows glucose or the sugar to enter the cell, and that glucose can be used for energy, or it can be converted into glycogen where it's stored in the liver and the muscles. And you'll have a normal blood glucose level. But if blood glucose drops because of, let's say, fasting, then the pancreas will release glucagon. Glucagon will then synthesize glucose from certain amino acids. It'll break down the glycogen that's stored in the liver and muscles into glucose and bring that normal blood pressure, or blood glucose, back into a normal range. So there is this constant maintaining of blood glucose levels. When it goes too high, the pancreas increases insulin. When it's too low, after we've slept all night and haven't eaten in 12 hours, the pancreas will release glucagon and release or break down glycogen so that we can have glucose for energy. So it's very important to maintain that balance, and by eating the proper foods and eating regularly throughout the day, that helps to maintain your blood sugar levels. So when insulin is released from the pancreas, what this does is it allows the glucose to enter the cells. It takes it out of the blood. So when people have problems with insulin, so they have insulin issues due to type 2 diabetes, then the glucose doesn't enter the cell, right? The cells become resistant to insulin, and so it doesn't leave the blood, and then the blood sugar levels go up too high, and that's what happens in diabetes. So if you don't eat, then your blood glucose will drop, and the pancreas will then release glucagon, as we said earlier, and that helps with glycogenolysis, which is breaking down the glycogen stored in the liver and muscles, and also stimulates lipolysis, or breaking down of fat for energy. So we store these macronutrients in the body, and then we can break them down when we need them for energy. Ketone bodies will result when there is not a proper breakdown of fat, and people who have poorly controlled diabetes end up having too many ketone bodies, and that ends up becoming a condition known as ketosis, and it's not a very healthy thing. It can cause serious issues. So making sure you are not having too low of a carbohydrate diet. For example, the Atkins diet, very, very low carbohydrates and a very high protein diet. That can cause this creation of these ketone bodies, and that would end up putting you into a state of ketosis, which is a very acidotic state, and it could really be harmful to the body. So what you want to do is make sure that you're eating the proper carbohydrates, not reducing all of them, but rather reducing the refined or the simple carbohydrates. Replace your sugar soft drinks with water. Eat whole grains and nuts instead of cookies. Have fresh fruits instead of candy. If you're looking for something crunchy, eat raw vegetables instead of chips. So that brings us into diabetes, which is a chronic disease that really is because of abnormal glucose, fat, and protein metabolism. Type 1 diabetes is an autoimmune disease, and the beta cells in the pancreas just stop making insulin. That's usually something that happens in the body when the mother is pregnant and the fetus is born, and it develops earlier in life. Type 2 diabetes is the most common type, usually develops later in life, although now we're seeing it in children as well because of poor diets and obesity. And what happens is the beta cells don't stop making insulin. It's just that the cells become resistant to insulin and won't allow the glucose to be taken out of the blood and into the cell. So if we classify diabetes, if your blood sugar, if you get a test done and you've been fasting all night, you have blood work done, if your level's between 70 and 99, it's considered normal. We also have values for pre-diabetes of 100 to 125. Diabetes is 126 milligrams or more. Another way we can classify diabetes is according to the A1C value. So again, via blood work, if your A1C is 4.5 to 5.7, it's normal. Anything above that is pre-diabetes or diabetes. Some signs and symptoms include elevated blood sugar levels, very, very thirsty, lots of urination, vision may blur, foot pain or numbness in the feet, sores that won't heal, increased appetite but you have weight loss, and you fatigue very easily or become confused. So if you have any of those signs or symptoms, you need to be seen by a doctor and be tested. You can control diabetes. There's maintenance of blood glucose levels, testing your blood every day with a glucometer to make sure what your blood sugar level is, and maintain a healthy weight, follow a special diet, and get regular exercise. And these are things that can help with diabetes. Type 1 cannot be prevented, but your risk for developing type 2 can be reduced by maintaining a healthy, normal weight, exercising daily, and follow a healthy diet that's lower in sugar. Hypoglycemia, this is an abnormal blood sugar level as well, but it's considered low blood sugar. And that is something that can happen, but it's still not a good profile for blood sugar. So less than 70 is considered low blood sugar. You can faint from that, and that's called hypoglycemia. One thing to look out for is a collection of conditions, and it's known as the metabolic syndrome. If you have a large waist circumference, have high blood pressure, high triglycerides, low good cholesterol, and high blood sugar, then you're known to have the metabolic syndrome, which raises your risk for developing heart disease. Lactose intolerance occurs because there's not enough lactase, the enzyme that breaks it down, so that some people end up having intestinal cramps, bloating, or gas and diarrhea when they're having lactose. Fortunately, there are alternatives with regard to dairy to be able to accommodate those who are lactose intolerant. Sometimes people worry that sugar causes hyperactivity, but studies have proven that there really is no correlation at this point. With the fiber that we eat, it really does protect our digestive tract, prevents diverticulitis, and really keeps our colon healthy as well. So fiber is very important for the digestive tract health and overall health. You can prevent colorectal cancer, heart disease, and it helps with weight control. So you want to make sure that you're eating enough fiber. Just remember, if you add fiber to the diet, add it slowly and gradually so the body gets used to it, and drink plenty of water with the added fiber. One thing to pay attention to is the glycemic index, which basically is determining if you eat this food, how quickly would your blood sugar rise and how high would it rise?